And welcome to WRPB and WRPB Studios. You know, we live in such a stressful world, and we're blessed to have people that are sitting next to me that can just kind of take away some of that pressure and some of that stress. With me is Hua Flower
Yes.
and Mika.
Yes.
So you guys are licensed massage therapists?
Yes.
Why did you get into that?
Because I enjoy massage myself. When I get a massage, I feel so good. Sometimes massage can relieve pain, soreness, and feel better. Sometimes just release stress, rejuvenate. So you feel a lot better. Myself very much enjoy massage. So I like people can enjoy the massage of good feeling and be more healthier too.
And it relieves stress too, right?
Yes, release stress. Yes.
How long are you doing it?
Oh, I did many years. When I was in China, I did a massage for 11 years. It's not included the vacation time. So factually, I started do massage when I was 21 years old. Now I'm 44 years. So it's many between hard breaks that doesn't count. So it's 11 years in China, and here my business open to massage for 4.5 years now. Yes.
Okay, Mika,
Yes.
you've been doing this a while too. How
Yes.
long have you been in the industry?
I've been in the industry about 17 years.
Okay, why? Why did you get into it?
Originally, I was in the medical field,
Okay,
and that was about 25 years doing that. And I decided I wanted to get something that I could do for myself, a career. And I stayed on the health side, so I do a lot of medical treatments.
so did you get massages prior to being a massage therapist?
Honestly, no.
Okay, you got massages prior, right? Before you became a massage therapist, you used to go for massages. Did you go for your own massages?
Go get a massages, yes. And when I was a child, I started giving my mom massage. I did not know how to massage. She just telling me to do this.
Right.
She feel great. So many years during the years, teenagers and child, I grew up. I always give her massage, and she liked it, and she feel better. So I always think massage is positive. Yes.
Okay. This is not something that you just do. You actually have to learn this. This is a therapy kind of thing,
Yes.
Correct.
and it's licensed.
Correct.
Yes.
Okay, so was there a lot to learn? Is there a lot to learn to do this?
Yes, a lot to learn. Including now, we're so many years already, still a lot to continue education. As long as we have time, a lot to learn. Still a lot to learn.
More men or more women?
I would like to think it's more women
Right.
than men, but a lot of the men who do come in, they're coming for sports massages or they're coming for medical treatments, and a few come in just to relax.
So what I'm getting is that women come to be pampered, and men come to take away from the pain or a sports injury or something like that.
Something like
That
that.
kind of be like really in the scenario of how it kind of lays out. Because I know women, you guys go get manicures and pedicures and massages for pampering. Okay, I don't know that men really think about it as being pampered, but as more of something functional.
Correct.
Yes,
Okay,
yes.
that's how I think about it. Okay, who's easier to massage, women or men?
I think it's both. Some you do not say men their muscle thicker so harder. It's not like that way. And even who is very skinny, they may take a very heavy pressure. Sometimes I feel, wow, you're so bony. If I use heavy pressure, I use my elbow bone to bone, I will hurt you. I'm worried, but no. Some clients really surprise me. Even they're so bony, they're taking heavy pressure. And some people, you think they have thick soft tissue, but they like only light touch, gentle touch. If more pressure, they say, "I hurt."
That would be me. That would be me.
Yes, so hard to tell. Is men harder or ladies harder? It's half. Yes.
I think
Okay,
it
so-
has more to do with body type.
Really?
Yes.
So, I'm going to guess that you're in an industry that has repeat customers. In other
Yes.
words, someone's going to come in once a week, once a month. How often do people come in?
It depends. Yes, some people. I had a client. He comes. He comes even twice a week.
Really?
Yes. Later changed once a week. Yes. A few days ago, I met a client. She even asked after the massage. She even asked, "Can I come tomorrow?" I said yes, if you can. Some clients come once a month. Some clients come only if they feel pain. They feel
Right.
needed. Yes.
And I mean, I kind of understand that, but I'm thinking that it's more of a continuous thing, because if your muscles tightened,
Yes.
on the first of the month, and you get a massage and you feel better, they're going to tighten again. It's going to happen again. It's not something that just happens once, right? I mean, people come back for the same thing.
I mean, essentially they do, but I like to teach my clients to go home and take care of their bodies. They stretch, they do a lot of hot water, hot towel treatments to help their bodies to adjust back to feeling how they felt after the massage.
Is there different kind of massages?
Yes. Yes.
A lot of different kind of massages?
Many kinds. Some even I do not do. Only she does. Yeah, lymphatic drainage she does, and prenatal massage for pregnancy ladies. Only she does. I am not certified for that yet.
Okay.
Yes, she does treatment. For example, the sciatica treatment, carpal tunnel, frozen shoulder. Some treatments she does. That kind, if is on acute or on some very painful that situation, yes, you want once a week or twice a week do something like that. For my massage, not a treatment, so it's just for you feel better, not like in very painful and non-functional problem. Then you can just according to your feeling. If you feel needed, you can come. If you feel fine, you can let's. Yes, it's fine.
Is it just you two at the place?
Now, yes.
Okay. I'm going to guess, because it's a licensed thing,
Yes.
that there's schooling involved.
Yes.
Correct.
Is it long-term schooling?
Depends on what you're going for.
Okay, which is interesting, because that brings back to what she said. There are things that you do that she's not, I want to
Correct.
say, certified to do.
Correct.
I don't know if that's the right terminology.
Yes.
What is it, because you were in the medical industry, that you decided to add those things to your repertoire?
Correct. The school I went to, they offered an advanced course. So the basic course was 6 months, and then the advanced course was another year and 6 months, approximately.
Do you have to have intern hours?
Yes. Well, they do it in-house. So
Okay.
it's called clinic hours.
Okay, intern clinic, and I get that. Okay, you give a massage. Are there different? And again, I don't know the wording, so I'm just going to use the wording that I know.
Yes.
Are there different lotions that you use, or different creams that you use for different type of massages?
I use grapeseed oil. Some clients request for the coconut oil.
Uh-huh.
We have coconut oil. So factory Mika that's essential oil too. But I maybe someday we will increase that for yes.
Do these different oils or lotions or whatever you want to call them serve different purposes within a massage?
Well, the oil itself, they each carry their own identity as to what it does for the skin. It's more of a topical.
Okay.
Okay, so grapeseed oil is a carrier oil, and you can add essential oils to it for aromatherapy or just muscle release. Coconut oil is great for the skin for exfoliation. It's an emulsion oil. So it's great for if you have dead skin coming off, or if you're trying to just have a slower drag on the massage, it slows it down a bit
Oh,
for
okay.
you.
That would make
it's,
sense.
It's the viscosity of the oil that will determine how fast you go.
Okay, so I've seen websites of massage people, and they almost all on their homepage has a picture of someone laying on a table with stones on their back, which would be like a hot stone massage.
Yes.
Correct.
Do you do this?
I personally don't.
Do you do
I
that?
do, yes.
Okay. It's really about the heat,
Heat, yes.
okay, that kind of relaxes the muscles? Is
Yes.
that really the scenario?
Yes, yes.
I-
And if someone like a little heavier stones working great to hot and stone, yes,
Mhm.
yes.
You know, it's interesting that they've come up with different things that do different, like essential oils that do different things, or like the hot stones, I guess, store the heat better than a lot of other things. It's really the stone is really the carrier of the heat.
Yes.
It's really not the stone per se. It's just the heat within the stone. Is that correct? What about the other side of the spectrum? Cold. Cold is like any massages that revolve around cold therapy.
Yes.
A lot of the treatments, massages that I do, I use cold. People tell me that they're tight, and essentially they're not tight. They're inflamed.
Right.
So with that inflammation, you want to put cold and not hot.
And that makes sense because inflammation is treated with cold, not hot.
Correct.
And I kind of understand that. Okay, we're getting to the top of our time. How do people find you? You have a website,
Yes.
which is?
Website is flower-murdoch-lmt.massagetherapy.com.
Okay. Flower being your middle name.
Yes.
Okay. I just want people to know that that's the middle name. And you have a phone number?
Yes.
Which is?
It is 772-812-9192.
And where are you guys located?
Right down the street.
In Port St. Lucie?
Correct.
Yes.
On US 1?
On
Yes.
US 1.
Oh, okay. You know, guys, sometimes it's about healing the pain, but a lot of times it's about relieving the stress.
Yes.
And we all deserve to be pampered in one way or another.
Correct.
Yes.
I want to thank you guys for coming on.
Thank
Everybody check them out, and we'll be right back.